Kamala Harris is making history as the first woman of color to be a vice presidential candidate. As a senator, her skills as a former prosecutor were known for turning congressional hearings into minefields for Trump administration officials. Nancy Cordes explains.
Be sure about your answer, sir.
She is one of the Senate's newer members.
Can you give me a yes or no answer,
in the closed
please?
briefing, well, it's not a short answer, Senator. The answer
It is either you are willing to do that or not.
And yet her interrogations are already legendary.
Attorney General Barr, has the president or anyone at the White House ever asked or suggested that you open an investigation of anyone?
I wouldn't.
Yes or no?
Could you repeat that question?
Harris came to Congress in 2017, drawing donations, presidential buzz, and attention on late-night TV.
Can you think of any laws that give the government the power to make decisions about the male body?
I'm not thinking of any right now, Senator.
Goddamn, Kamala Harris brings it, man.
In 2017, her grilling of then Attorney General Jeff Sessions.
My question is only as
don't have the
to your
detailed
knowledge.
memory of that.
This startling admission.
I'm not able to be rushed this fast. It makes me nervous.
Last year, his successor, Bill Barr, struggled too.
They have not asked me to open an investigation, but
Perhaps they've suggested,
I don't know. I wouldn't say suggest.
hinted,
I don't know.
inferred. You don't know.
Nancy Cordes, CBS News, Capitol Hill.
Senator Kamala Harris's historic candidacy is raising questions about how she will be evaluated as a candidate. In an article for the Washington Post earlier this week, Margaret Sullivan writes about how the media can avoid playing into any tropes. And Margaret joins me now to discuss this. She is a media columnist for the Washington Post. Margaret, it is really interesting to have this conversation with you. Thank you so much for joining us. Now that we do have a woman of color as Joe Biden's running mate, what is your view on how news organizations can better handle their coverage?
So I think they need to give some really serious thought to the ways wording is deployed, the way stories are framed, and the way, sort of unconscious misogyny or sexism or racism can creep into coverage. And, you have to, I think there needs to be kind of a hyper awareness of it in order to avoid some of the things that we've seen before, whether with Sarah Palin or certainly Hillary Clinton and others. So it takes some real thought and awareness in advance, and now that it's happened, we have to do it on the run.
So specifically, what kinds of mistakes and stereotypes do you think need to be countered or challenged while covering Senator Harris?
Well, Senator Harris is, as you noted, the first woman of color to be in this position. And we know that President Trump has been particularly critical of women of color, whether they are correspondents for news organizations or whether they're politicians like the so-called squad in Congress. He's been, I think, particularly aggressive and in some cases really disparaging. So when that kind of thing comes up, whether she's being called a nasty woman or some other insult, we have to think about, are we going to simply amplify that by repeating it, or is there some other way to handle it, for example, by putting it in context and not simply providing a megaphone for it?
So, as you know, this group called We Have Her Back, made up of influential women, including former Obama senior advisor Valerie Jarrett and the leader of Planned Parenthood, are among the group that sent this open letter to top newspapers and network executives last week. I wonder, in your view, Margaret, how different is the landscape and the environment that this election and this contest is taking place compared to just 4 years ago?
So, there are a couple of really key differences. One is that the person at the top of the ticket is Joe Biden. He's a white male, as opposed to Hillary Clinton. So the pressure was really on her. And I think having Kamala Harris in this, in the secondary role will still put her in the spotlight, but not quite as much. In addition, I do think that, and I'm always hopeful that the news media has learned something since the coverage of Hillary Clinton, which was in many cases fraught with these kinds of, deeply insulting images and tropes that really reflected a societal tendency towards, unconscious in some cases, or some cases conscious sexism. So I hope we've learned something, and I think it's also a little bit different because she's not at the top of the ticket. She's, somewhat secondary.
You mentioned President Trump. I want to play some of what the president said regarding Senator Harris. Let's go ahead and listen to some of that.
I've been watching her for a long time, and I was a little surprised. She was extraordinarily nasty to Kavanaugh, Judge Kavanaugh then, now Justice Kavanaugh. She was nasty to a level that was just a horrible thing, the way she treated now Justice Kavanaugh.
So, Margaret, given that, in 2016, we saw actually some supporters of Hillary Clinton wearing that insult, nasty, as sort of a badge of honor, what do you think when you hear this strategy being deployed now, calling Kamala Harris, quote unquote, nasty?
Well, I do think it has the potential to backfire. And, I think women to some extent are wearing that phrase, whether it's with a hashtag or not, as something of a badge of honor. But that's not true of everyone. And it still should be startling to us to see the president being so disparaging. And, I still sort of stand by my idea that we have to be very careful in the way we amplify that kind of thing. That may not be the only kind of insult that is tossed her way. And, please understand, I think she needs to be held to account. Her stances need to be challenged, her background. She should be just as vetted as any other candidate. It's not about giving her a pass. It's about creating an even playing field.
Right, absolutely. The words we use certainly carry great power and also responsibility. Margaret Sullivan. Margaret, thank you very much for joining us.
Thank you for having me.
New federal data show nursing homes saw a surge in coronavirus cases last month. As David Begnaud reports, the industry is now on high alert.
We don't know when my mom got sick. We don't know how long she was sick.
That is Caroline Fari. She says she had no idea her 90-year-old mother, Virginia Smith, was receiving end-of-life care until 2 days before she died at her Boise, Idaho nursing home.
One of her frontline care workers, an aide, had called me on my cell phone from her private cell phone, and she wanted me to be able to talk to my mom. And I didn't understand what that meant.
Fari says her mother had a high fever and had lost a tremendous amount of weight, but that the facility where she lived, Shaw Mountain of Cascadia, had not tested her for COVID-19.
Was she treated for coronavirus?
No.
Why not?
Good question.
When she was finally tested after the family insisted, the results were positive. Ms. Smith died the next day. In July, cases and COVID-related deaths in nursing homes rose, along with cases nationally. The Trump administration has said protecting nursing homes is a priority. At this news conference last month, officials promised to provide tests and rapid testing instruments to the nation's more than 15,000 nursing homes. But Tuesday, the president delivered a much smaller number.
We have delivered over 1,800 rapid point-of-care testing devices to nursing homes.
We're now getting pretty close to the same numbers of new cases in nursing homes that we were experiencing at the highs in the spring.
That is Mark Parkinson, CEO of the American Healthcare Association. He says the wait times for tests at nursing homes can take as long as 6 days, making it harder to protect the most vulnerable, like Virginia Smith, whose daughter is heartbroken over how her mother spent her last days.
It's a callous disregard for my mother and for her right to have a peaceful death and a dignified death. She suffered.
Miss Virginia Smith had 12 grandkids, 10 great-grandkids, was a devout Catholic and went to Mass every day, her daughter said. She was in relatively good health before she contracted coronavirus and died. We reached out to the nursing home in Idaho to specifically address the concerns raised to us by the family. We have not heard back. I do want to tell you that an attorney representing the company that owns the nursing home told an Idaho newspaper which covered the story that the company is continuing to follow all applicable guidance from federal and state health agencies and working to provide safe care and mitigate the damage of COVID-19. David Begnaud, CBS News, Miami.
In Health Watch, pediatricians are warning there could soon be a surge in preventable childhood diseases. A new survey finds many parents are worried about the doctor's office during the pandemic, so children could be missing out on critical vaccines. Tom Hansen reports.
5-year-old AJ Velasco's first day of kindergarten will be virtual because of the pandemic.
It's not that we don't want to send him back. He definitely prefers and succeeds in a face-to-face environment. But for his safety, we don't feel confident yet.
His mom says when it's time to head back to the classroom, he'll be ready. AJ receives all his vaccinations on time.
For his own well-being, to keep him healthy and well, but to also keep the other kids in his class healthy.
Childhood vaccinations have significantly dropped since the coronavirus began spreading in the U.S. Now a new Orlando Health survey of more than 700 parents finds 67% are still nervous about taking kids to the pediatrician.
Vaccine preventable diseases aren't gone. We really all rely upon our general population of pediatric patients to be protected at a rate well over 90% in order to prevent spread of these diseases.
Pediatrician Dr. Alex Kassler says parents should reach out to their providers for reassurance. Many are staggering appointments and wearing protective gear to keep everyone healthy.
Abandoning preventive care and vaccines is much more dangerous than entering into a safe medical environment that's geared towards keeping people well.
Skepticism around vaccines remains. 38% of parents surveyed believe their child doesn't need all the vaccines recommended. That usually includes the flu shot, something Dr. Kassler says should be on everyone's radar this fall.
In the middle of this pandemic, we want to prevent anything we can prevent.
She hopes parents get the message. Tom Hansen, CBS News, New York.